Signs and symptoms are both signals of injury, illness, disease, signals that something is not right in the body. A sign is a signal that can be seen by someone else, maybe a loved one, or a doctor, nurse, or other healthcare professional. For example, fever, fast breathing, and abnormal lung sounds heard through a stethoscope may be signs of pneumonia. A symptom is a signal that's felt or noticed by the person who has it, but may not be easily seen by anyone else. For example, weakness, aching, and feeling short of breath may be symptoms of pneumonia. Having one sign or symptom may not be enough to figure out what's causing it. For example, a rash in a child could be a sign of a number of things, such as poison ivy, measles, a skin infection, or a food allergy. But if the child has the rash along with other signs and symptoms like a high fever, chills, achiness, and a sore throat, then a doctor can get a better picture of the illness. Sometimes, a patient's signs and symptoms still don't give the doctor enough clues to be sure what's causing the illness. Then medical tests, such as X-rays, blood tests, or a biopsy may be needed. For that reason we should know some of the general signs and symptoms of cancer. But remember, having any of these does not mean that you have cancer. Many other things cause these signs and symptoms too. If you have any of these symptoms and they last for a long time or get worse, please see a doctor to find out what's going on. 1. Unexplained weight loss. Most people with cancer will lose weight at some point. When you lose weight for no known reason, it's called an unexplained weight loss. An unexplained weight loss of 10 pounds or more may be the first sign of cancer. This happens most often with cancers of the pancreas, stomach, esophagus, swallowing tube, or lung. 2. Fever. Fever is very common with cancer, but it more often happens after cancer has spread from where it started. Almost all people with cancer will have fever at some time, especially if the cancer or its treatment affects the immune system. This can make it harder for the body to fight infection. Less often, fever may be an early sign of cancer, such as blood cancers like leukemia or lymphoma. 3. Fatigue. Fatigue is extreme tiredness that doesn't get better with rest. It may be an important symptom as cancer grows. But it may happen early in some cancers, like leukemia. Some colon or stomach cancers can cause blood loss that's not obvious. This is another way cancer can cause fatigue. 4. Pain. Pain may be an early symptom with some cancers like bone cancers or testicular cancer. A headache that does not go away or get better with treatment may be a symptom of a brain tumor. Back pain can be a symptom of cancer of the colon, rectum, or ovary. Most often, pain due to cancer means it has already spread, metastasized, from where it started. 5. Skin changes. Along with skin cancers, some other cancers can cause skin changes that can be seen. These signs and symptoms include darker looking skin, hyperpigmentation, yellowish skin and eyes, jaundice, reddened skin, erythema, itching, and excessive hair growth. Along with the general symptoms, you should watch for certain other common signs and symptoms that could suggest cancer. Again, there may be other causes for each of these, but it's important to see a doctor about them as soon as possible, especially if there's no other cause you can identify, the problem lasts a long time, or it gets worse over time. Change in bowel habits or bladder function. 1. Long-term constipation, diarrhea, or a change in the size of the stool may be a sign of colon cancer. Pain when passing urine, blood in the urine, or a change in bladder function, such as needing to pass urine more or less often than usual, could be related to bladder or prostate cancer. Report any changes in bladder or bowel function to a doctor. 2. Sores that do not heal. Skin cancers may bleed and look like sores that don't heal. A long-lasting sore in the mouth could be an oral cancer. This should be dealt with right away, especially in people who smoke, chew tobacco, or often drink alcohol. Sores on the penis or vagina may either be signs of infection or an early cancer, and should be seen by a health professional. 3. White patches inside the mouth or white spots on the tongue. White patches inside the mouth and white spots on the tongue may be leukoplakia. Leukoplakia is a precancerous area that's caused by frequent irritation. It's often caused by smoking or other tobacco use. People who smoke pipes or use oral or spit tobacco are at high risk for leukoplakia. If it's not treated, leukoplakia can become mouth cancer. Any long-lasting mouth changes should be checked by a doctor or dentist right away. 4. Unusual bleeding or discharge. Unusual bleeding can happen in early or advanced cancer. Coughing up blood may be a sign of lung cancer. Blood in the stool, which can look like very dark or black stool, could be a sign of colon or rectal cancer. Cancer of the cervix or the endometrium lining of the uterus can cause abnormal vaginal bleeding. Blood in the urine may be a sign of bladder or kidney cancer. A bloody discharge from the nipple may be a sign of breast cancer. 5. Thickening or lump in the breast or other parts of the body. Many cancers can be felt through the skin. These cancers occur mostly in the breast, testicle, lymph nodes, glands, and the soft tissues of the body. A lump or thickening may be an early or late sign of cancer and should be reported to a doctor, especially if you've just found it or notice it has grown in size. Keep in mind that some breast cancers show up as red or thickened skin rather than a lump. 6. Indigestion or trouble swallowing. Indigestion or swallowing problems that don't go away may be signs of cancer of the esophagus, the swallowing tube that goes to the stomach, or pharynx, throat. But like most symptoms on this list, they are most often caused by something other than cancer. 7. Recent change in a wart or mole or any new skin change. Any wart, mole, or freckle that changes color, size, or shape, or that loses its sharp border should be seen by a doctor right away. Any other skin changes should be reported, too. A skin change may be a melanoma which, if found early, can be treated successfully. See pictures of skin cancers and other skin conditions in our skin cancer image gallery. 8. Nagging cough or hoarseness. A cough that does not go away may be a sign of lung cancer. Hoarseness can be a sign of cancer of the larynx, voice box, or thyroid gland. The signs and symptoms listed above are the more common ones seen with cancer, but there are many others that are not listed here. If you notice any major changes in the way your body works or the way you feel, especially if it lasts for a long time or gets worse, let a doctor know. If it has nothing to do with cancer, the doctor can find out more about what's going on and, if needed, treat it. If it is cancer, you'll give yourself the chance to have it treated early, when treatment works best.